Good evening, everyone. My name is John Bacor, and I choose about the healthcare issues here in the Philippines, no? Because I think addressing healthcare reform or the universal access to affordable healthcare services is really needed right now. Because not everyone has the access for the affordable healthcare. But as a Filipino or as a Filipino citizen, it is one of our fundamental human rights to afford or to access affordable healthcare services, no? But we struggles in so many ways, just like medical cost, the different level of treatment, because if you're poor and you don't have money, you're not going to be prioritized in our healthcare. We also need to have a well-constructed policy first that can bridge these gaps for us to be able to ensure that everyone has the equal access for healthcare. In agenda setting, the first thing we should be able to do was, I think we should first recognize these issues or healthcare issues as a national priority. We should prioritize it first. We can gather some data to some healthcare accessibility issues with engagement with the stakeholders, the medical professionals, the patients, the hospitals, clinics, and healthcare providers also. And also to raise public awareness. We can also try approaching or conduct some research on different levels of treatment in healthcare. We can also utilize the online campaigns or medias to highlight such urgency to or awareness of these issues. We can also ask collaboration with the stakeholders or the policy makers, implementors to place this or prioritize these issues and to address this to the legislative or to pass this reform or healthcare reform to the legislative agenda soon. During the policy formulation, we can also develop possible policy option first, no? For us to be able to select what is the most effective approach to improve healthcare accessibility here in the Philippines. Or we can also engage with experts to draft evidence-based proposals and we need to consider the best medical practices internationally, as we can also adapt and apply it in our medical practices here in the Philippines. Also propose legislative measures like regulating drug prices, because some of the drugs are overpriced already, and we poor citizens can't afford such drugs or medication. We can also like to expand insurance programs, because it can help not just the poor but everyone who is seeking medical insurance that can't afford medical treatment. Also increase the government funding in healthcare facilities, infrastructures, and equipment, as it is the basic needed for us to be able to serve the public. In policy implementation, once this policy is adopted, the government agencies and healthcare institutions must effectively execute it. We can work with DOH and other related bureaucratic organizations to conduct public healthcare programs, no, for the awareness of the public. We can also ensure proper funding allocations and establishing partnerships with hospitals and clinics and other healthcare facilities to provide services effectively and efficiently. Then the policy evaluation, during this, we can assess the effectiveness of the policy we implemented and determine the necessary adjustments that we need to do. We can use performance metrics for the employees, or we can also conduct surveys, case studies, and research or analyze the impact of these policies, or the outcome of these policies. We can gather also feedbacks from the patients and the medical professionals. It is very needed because getting their feedback can refine or adjust our implemented policy. Then, what is the role of bureaucratic organization? Bureaucratic agencies plays a very crucial role in the implementation and execution, and also in implementation of healthcare reform or policy. The DOH, insurance regulatory bodies, and public hospitals, they are the one who is responsible for enforcing regulations, managing resources, and ensuring compliance with the new policy. Because without them, we can't really execute this policy. There are many challenges that come to my mind. But the most basic one is the challenge to change. Not everyone is capable or have the courage to go out to their comfort zones. This challenge to change is very basic challenge, as the healthcare providers and insurers may resist new policy due to financial and or operational concerns. But we can also try to provide incentives. We can conduct training programs and engage in continuous communication with stakeholders for them to foster collaboration and cooperation. The second challenge maybe is limited and fund limitation. It is also one of the basic challenges that we face, because we have budget constraints. Like, we should budget our resources well. It can hinder policy implementation or execution, but we can explore alternative funding sources like private-public relationship or partnerships, or we can also try to reallocate existing healthcare budgets. This healthcare reforms or policy is essential to ensure that everyone has the equal access to the medical services. Through policy formulation process, we can craft effective policy that improves public health outcomes here in the Philippines. That will be all. Thank you.